Okay, so we're going to have our last class. And actually, right now we have just 5 students. So, well, 6 now, I guess. Yeah. Okay, so does anybody want to start, or would it be a random thing? We have 6 students. Okay, we're going to get started with, let's say, Paola. She's always the last one, so she deserves it. Okay, so you will have your 15 minutes each one, and I'll see you at the end of the class, please. Okay, see you. Hello, Paola.
Hello.
Hey, how are you doing?
Fine.
Okay, so we're going to have our last class. Well, from now on, we have your 15 minutes, okay? So
Okay.
what we're going to do is this. You are going to choose any system, any body system you want to. You can tell me right now, which one are you going to choose?
Okay. I want a cardiology system.
Cardiovascular system.
Yes, yes. Because I like the topic EKG.
Okay, great. So actually first, you're going to tell me um, the structures you find in the cardiovascular system. Okay. Okay, so what do you find? What do you have in your cardiovascular system?
Okay. We can found arteries,
Okay,
veins.
okay,
Um. Okay. I remember the heart is the principal.
okay, the main one. And
Yeah.
do you remember any, well, the structures inside the heart?
Yeah. Yeah. I remember a left pulmonary artery, a left atrium, left pulmonary veins. The bulbs. It's mitral bulb.
Mitral.
Mitral. Mitral bulb. Um, tricuspid bulb. Um, pulmonary semilunar bulb. Um, tricuspid bulb. I don't know. I remember the superior vena cava, right pulmonary artery, pulmonary trunk, right atrium, the right pulmonary veins, um, right ventricle, inferior vena cava, myocardium. There is epicardium, myocardium, endocardium, left ventricle, papillary muscles. I don't know. Um, yeah, this
Okay,
I remember this
you remember those structures,
principles.
right?
Yeah, yeah.
Okay, let me correct a little things you, well, you had a little mistakes on some words about pronunciation. It will be muscles. Okay, muscles.
Okay. Muscles.
Okay, muscles. It's like there's no the C, right? It's muscle, right? But it's pronounced muscle. It's
Muscle.
vena cava, not cava, cava,
Vena
right?
cava.
Okay,
Okay.
papillary muscles. Papillary muscles. What else?
Popular.
Myocardium, not myocardium, myocardium.
Myocardium.
Okay. So could you explain a little bit about, well, anything about physiology inside the heart?
Okay. The EKG, right?
Not the ECG. Well, not yet, at least. Could you tell me
Okay,
anything
okay.
about physiology? Maybe I
Okay.
don't know. If you like ECG, maybe you could tell me a little bit about
Um,
the conduction system.
okay. First, I think the heart is the key organ of the cardiovascular system, right? And the body's transport system for blood, and muscles that contacts rhythmically and autonomously. I don't know. It works in conjunction with an extensive network of blood vessels running throughout the body. Basically, the heart is a pump ensuring the continuous circulation of blood in the body. I think I read the heart the heart weights around, I don't know, I remember that it is 3050. How do you say gramos?
Greens.
I read this concept. The heart weights around 350 grams, and it's roughly the size of an adult's clench at first. I remember that the heart has a muscular layer.
Layer. Okay.
Yeah, layer. The myocardium, right? The made up of cardiac muscle cells, and an inner lining called the endocardium. And the inside of the heart is divided into four chambers. This is two atria and two ventricles, separated by cardiac valves that regulate the passage of blood. Um, the heart is enclosed in a sac, the pericardium, which protects it and prevents it from overexpanding, and coring it inside the thorax. The pericardium is attached to the diaphragm.
Diaphragm.
Yeah, diaphragm. Sorry.
Diaphragm. Okay.
Attached to the diaphragm and inner surface on the sternum. And yeah, and this is there's many concepts about the atrial ventricles, cardiac valves, coronary circulation. I think that the coronary circulation is very interesting. How works the blood into our body.
Okay. Okay. Could you tell me anything you want to about ECG?
Yeah. I want to read the ECG. I don't know if you can explain how read the ECG. I learned one way. It counts desde atrás, contar hacia atrás.
Okay.
Yeah, and I know that I learned a lot of how works the ECG in a for example in a patient.
Okay. So basically, well, you just told me about some structures, right? Could you tell me, well, since you like ECG, could you tell me a little bit about the conduction system?
Okay. Um, the the circulation of heart conduction system, right?
Mm, the conduction system.
I know the okay. The heart conduction systems. Um, when a patient it's very bad of heart. I remember that the is a network of nodes, right? Cells and signals that controls our heartbeat.
Okay.
Each time our heart beats, electrical signals travel through our heart, and these signals cause different parts of our heart to expand and contact. The expansion and the contraction control blood flow through our heart and body. Um,
Could you tell
I
me the
remember that.
structures related to the conduction system? Do you remember?
I remember that there's two types of cells control of heartbeat: the conducting cells and the muscle cells.
Okay, and what about the nodes? Maybe the internodal. I don't know. Do you remember the nodes? The
No,
atrioventricular node and the sinoatrial node.
yeah. I remember it is sometimes called or heart's natural pacemaker.
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 Okay.
Sorry. Yes. It sends the electrical impulse that starts the heartbeat. The sinoatrial, right?
Sinoatrial, yes.
Sinoatrial node is in the upper part of our heart's right atrium. It is a it is at the edge of our atrium near your superior vena cava, right?
Yes, vena cava.
Vena cava. Yeah. Uh, and our autonomic nervous systems controls how fast or slowly or sinoatrial node sends electrical signals. This I remember that this part of the nervous systems directs hormones that control our heart rate based on what you are or we are doing. For example, your heart rate increase during exercise and is low when you are asleep. I don't know. This is I know these concepts about sinoatrial.
Okay, and besides the sinoatrial node, is there any other structure related to the conduction system?
Atrioventricular node.
Okay, and is there any, well, there are actually three main structures between the sinoatrial node and the atrioventricular node. Do you remember the names of those structures?
Bundle of his.
They're bundles, however, they have different names because the bundle of his comes right after the
Atypical bundle.
yes, right after. However, between the sinoatrial node and the atrioventricular node, there are three structures. Do you remember?
Mm, um, no, I know that I remember that Purkinje, I don't know, Purkinje fibers?
Fibers.
Fibers.
Okay,
Yeah.
actually, the Purkinje fibers are at the end of the conduction system. I'm going to say it in Spanish for you to understand the question, okay? Primero está el nódulo sinusal, right? ¿No es cierto?
Sí.
Y después hay tres haces que conectan el nódulo sinusal con el nódulo auriculoventricular. ¿Te acuerdas los nombres de esos tres haces o bundles en English?
No, no recuerdo.
Okay. The anterior is the Bachman bundle. The medium is the Benkeback bundle. And the posterior one is the Thorel bundle. Okay. Okay, those three structures connect the sinoatrial node and the atrioventricular node. Okay, you did great.
Thank you.
You have a few mistakes on your pronunciation.
Okay.
For example, you said signals. It is actually signals. Okay,
Signals.
when there's the word sign, then you can say sign. However,
Sign.
it's when you have signal, it's signal. Okay.
Okay, thank you.
Okay, you're welcome. So it's really well. It's been a pleasure to meet you. I think
Me too.
you have a lot of potential because I think you like our career and which is really demanding as you have your dad.
Yeah.
You know how difficult it is, right? It's
Yes.
well, we have a lot of challenges day by day, and I think you're excited when you read, when you listen to some things that I think I find interesting, and it's great to see that enthusiasm in you guys, especially in you, Paola. I mean, you get excited with some things that I try to teach you, and I think it's great. I think you're going to be an awesome doctor, and it's been a really pleasure, a huge pleasure to meet you. And well, this is our last class. I'll see you at the end of the class for our survey. Okay.
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 Thank you. God bless you.
Thank you. You too. Bye.
Bye.
Who's next? Hello, Brisa.
Hey, good evening.
Hey, how are you doing?
Good, thanks.
Okay, so from now on, we have your 15 minutes, okay? This is our last class. So I'm going to give you, well, this is what we're going to do, okay? You're going to choose any body system that you want. You can choose now.
A body system?
Yes, a body system. You have the respiratory system, the cardiovascular system, musculoskeletal system, nervous system, anything, any system that you want. There's a lot of systems, right? So choose.
The gastrointestinal system could be?
Okay, gastrointestinal system. Could you tell me? Well, this is what we're going to do first. Uh, well, the first classes that we had, we actually talked about body parts, right? It was back then in November or beginnings of December, I think. So and this is what we're going to do. You chose gastrointestinal system. You're going to tell me the names of all the structures you remember about the gastrointestinal system first. You can go on now.
Like mouth, salivary glands, esophagus, liver, gallbladder, stomach, the pancreas, large intestine, small
Intestine.
is the intestine, sorry, appendix, um, rectum, and the anus.
Anus.
I think that's it.
Okay, anus. Okay. So you can choose any disease. Well, let's talk about physiology first. Do you want to tell, would you like to tell me anything about physiology? Anything you want to about the physiology and gastrointestinal system?
Sorry, I didn't listen.
Okay, so you can tell me now anything about physiology related to gastrointestinal system.
It could be the mobility, maybe.
Peristalsis or something related to it?
Yes. Can I explain about it?
Sure, do it in English.
Mm, okay. The gastrointestinal tract generates mobility using the smooth muscles, and then this unit just fire spontaneously in either a tonic or a phasic fashion, and with contractions. And tonic contractions are those contractions that emanated from several minutes up to hours at a time.
Okay, what else could you tell me about it? Is there any hormone neurons related primary, secondary, tertiary, peristaltic waves? Anything you want to? I'm all ears.
Oh well, this occurs in the sphincters. I don't know how to say
Sphincters.
that.
Sphincters.
Sphincters of the tract, and as well as in the anterior stomach, I think.
Okay, so let's start with the esophagus, okay? What kind of peristaltic waves do you know?
Right now, I can't remember.
You remember the primary? I told you about it. Secondary and tertiary.
Um,
When we swallow, actually, we start the primary peristaltic wave. And well, deglutition, you remember I talked about deglutition. It is related to the peristaltic, the primary peristaltic wave. However, there's a different stimulation related to the secondary peristaltic wave. Do you remember anything about it?
No, I really don't know.
Okay. Okay, what kind of hormones or molecules are related to the relaxation of the lower esophageal sphincter? Because you told me about sphincters, right? Do you remember?
I think no, I don't know.
Okay, in Spanish would be péptide intestinal vasoactivo, and the other one is related to nitrogen. Do you remember that? That one, actually?
Maybe gastrina. I don't know.
Okay, do you remember anything about gastrin? Which cells produces gastrin?
It's the principal hormone in the that produce the acid in the stomach.
It's one of the stimulations. It is, yes. Do you remember the cell that produces gastrin?
No, I don't remember that.
Okay, it is actually the G cell. That is why it is called G cell, because of gastrin, okay? So gastrin, G cells releases gastrin, and the gastrin goes to what kind of cell to stimulate it? What is the action of the gastrin?
Well, is the main hormone that controls the acid production.
Production, okay. And what cell produces the acid?
The G cell.
Nope. The G cell produces gastrin. However, that is how actually the G cell stimulates the parietal cell. Remember, parietal cells are stimulated by three main ways, actually. One is gastrin, the other one is through the nervous system, and the last one is through, do you remember?
No.
Okay. Okay, so parietal cells parietal cells have actually three main stimulations for it to get activated, okay? One is gastrin, the other one is the nervous system through, in Spanish would be acetylcholine, right? And the last stimulation for the parietal cell to get activated is through, in Spanish would be célula enterocromafin that releases histamine. So those three main stimulations activate the parietal cell, which produces acid. Okay, so is there any disease related to the gastrointestinal system you might want to talk about?
Could be appendicitis, maybe.
Okay, it's like a surgical pathology, right? Could you tell me anything you want? Tell me anything you want to about this disease, please.
The appendicitis is appendix inflammation. and it just the patient will feel a lot of pain, and it usually starts on the epigastric region, and once this disease get bad, and the pain usually moves to the right iliac fossa.
Okay, we talked about quadrants. Do you remember? Lower right,
The
lower right quadrant, actually. Okay. So, could you tell me what is the main cause of appendicitis?
a fecalito.
Okay, great. Well, could you tell me anything about Morphy's chronology or Alvarez score?
Well, the Morphy sign is refers to the pain and the um, apnea, apnea posterior.
Okay, that is
And
when you push, right?
yes, and when you push for maybe 30 seconds, and then you sudden throw your hand away, and the you have to see the patient face.
Okay, that could be Murphy's sign, right? What about Murphy's chronology?
Mm, that is for the symptoms, I think,
Symptoms.
symptoms, and is nausea, vomiting, anorexia,
Okay.
and I forgot the other one.
Okay, the first one actually is a dull pain. Okay, pain, abdominal pain that is not well localized. Right after comes nausea and vomiting, and right after comes the migration of pain to the lower right quadrant. Okay, so that I'm going to say it in Spanish for you to remember, okay? La cronología de Murphy es tal cual nos está diciendo crono, quiere decir tiempo, ¿no es cierto? Entonces, cronología es una sucesión de hechos que tienen que ir en ese orden específico. Entonces, la cronología de Murphy es como tiene que desarrollarse en teoría una apendicitis clínicamente, es primero un dolor no localizado, un dolor abdominal no localizado, vagamente localizado en epigastrio. Después hay náuseas y vómitos y después la migración de dolor hacia la fosa ilíaca derecha. Entonces tiene que seguir ese orden. Esa es la cronología de Murphy. Okay? Okay, so what could be the treatment for appendicitis? Or first, let's talk about Alvarado's score. Do you remember? We talked about it.
I think I do. Is the migration of pain, anorexia, maybe nausea,
Okay.
fever, leukocytosis,
Leukocytosis.
and I think that is, and the pain in the right lower quadrant.
Okay, you have a mnemonics right there. Mantrals. M, migration of the pain. A, anorexia, you told me, right? N, nausea and vomiting. T, what is T? You didn't tell me T. Temperature, right? You told me fever, right? R, what is R? Do you remember?
Isn't that the rebote, signo de rebote?
Yeah, rebound. Okay, rebound. And no, E. Do you remember E?
No, I don't remember the.
What about S? It's mantrals. You told me leukocytosis, right? What about S? Mantrals. S.
No, I don't remember that.
Okay. S means shift. In Spanish, desvío a la izquierda, right? Shift to the left. So you have leukocytosis with a shift to the left. Leucocitosis con desvío a la izquierda. Okay. Do you know what a shift to the left is, right? In Spanish, maybe?
I think it's cuando los neutrófilos jóvenes se van a la. Sí, los neutrófilos jóvenes hay una desviación a la izquierda y ahí se puede indicar la presencia de una infección bacteriana.
Yes.
Cuando
Yeah.
la anulación es prominente.
Yes, great. So that is shift in English, okay? Shift, desviación. Okay, we're done with your 15 minutes. Let me tell you, you have, I think, one of the best pronunciations here and between your classmates. You have awesome pronunciation. You almost sound like a native speaker. Keep practicing. I know you're going to make a really good doctor. This is my way to say, keep doing it. It's been a really huge pleasure to meet you. And well, I hope to see you some other time. And take care, and I'll see you at the end of the class for the survey, okay?
Okay, thank you. And I have a question. Could we have the slides?
Sure. Which one do you want?
If it's possible, everything.
Okay. However, yeah, I think I can do it. If I don't do it today, because I have some work to do, I'll do it by the weekend, okay?
Okay, it's fine. Thank you so much.
Okay. See you at the end of the class, please.
Okay, bye.
Okay, bye. Leonardo, are you here? Hello? Hello, Bernardo, are you here? Hello, Bernardo, are you here? Okay, guess you are not. Hello, Danita.
Hello.
Okay, I hear you really, really low. Is your volume okay?
And now?
I think it's better. Yeah. Okay, thank you. So we're having our last class actually.
Yes.
Okay, so this is what we're going to do, okay? You are going to choose any body system that you want right now.
Okay. And you're gonna ask me like,
Sorry, I can't hear you. It's really, really, really low. Give me 1 second. I'm going to connect my headphones.
me too.
Hello?
Better?
Okay,
Better now?
I hear you better now. Okay. So, you were saying?
Oh, okay. I'll choose one system, and you're gonna ask me about it.
Okay. What structures do you find in that system? Could you name the structures?
I didn't choose. I didn't choose one yet. Um,
Okay. I can't hear you that well.
um,
Okay, I think I hear you now. You're coughing, right?
yes, a little bit.
Okay, so what system is it gonna be?
Okay. I'm not really sure. Maybe. Um, okay. Um, I'll go for gynecology.
Okay, reproductive system, right?
Reproductive. Oh yes, yes,
Yeah,
yes.
well, it is actually female reproductive system since you want to talk about gynecology, right?
um, yes, yes.
Okay, so could you tell me the structures you can find in reproductive female system?
Um, okay. We found the vagina, cervix, the uterus, fallopian tube, um, I don't know how to say, ovaries,
Ovaries?
ovaries, yes. um, I think that's the most important ones.
And you're missing one really important, like tubes. Do you remember the name of those structures that resemble tubes between the ovaries and the uterus?
The I said the fallopian tubes,
Okay, fallopian tubes.
ovaries,
Okay,
yes.
sorry, I didn't hear that. Okay, so could you tell me anything about physiology related to the female reproductive system? Maybe the menstrual cycle or anything you want to about, well, related to the physiology.
Um, menstrual cycle. Okay. Um, it has like Okay, the menstrual cycle, it has, how I said, dura.
Sorry, I didn't hear that last
I
part.
want to say that the menstrual cycle, el ciclo menstrual dura.
Lasts, okay. Lasts.
Oh, okay. Oh, yes, lasts. I think 21, 28 days. It includes three main phases. The follicular phase, and that's the first phase, in the luteal phase. And okay. And there's two important like events during this, like the menstruation, when the woman bleed, the ovulation, to okay. I don't know what to say. The ovulation, it's happens at the 14th day of this, between like the follicular and the luteal phase. There's a variation of hormone levels and the cycle, when the different female hormones are in different, like I don't remember the, like the FSH, it's a little bit more increased in the 14th day. The LH, the LH as well. The estrogen and progesterone are increased too. There's also the uterine cycle.
Okay.
That has like basis to the proliferative secretary, and there's one, but I don't remember. What more can I say?
Okay. Do you remember the hormones related to each phase of the menstrual cycle? And which one is increased in each one of those? In the first part, in the follicular phase, which hormones are in higher levels?
It's the FSH.
Okay.
Also the LH.
And at what part of the cycle is do we find higher levels of LH?
um, it's in the ovulation day, like the 14th day.
Okay, right at
The follicular.
right before the ovulation, actually, right? And that is the trigger effect, actually, related to the LH peak. And what about what is the other part of the cycle, the other phase?
The luteal phase. Um, there's like the progesterone is increased in this phase. Well, I don't know, I don't remember. I think it was luteum that produces progesterone.
Great.
That it's like it's a very important hormone. Um, and I think that
Okay. Okay, great. You told me about what I asked for, the hormones related to each part of the menstrual cycle. Could you tell me anything about any pathology, any disease related to gynecology? Just the basics. I mean, we don't need to go deeper inside any topic. Just the basic of any disease.
um, the, about the cysts, mm, síndrome de ovario poliquístico.
Okay. What can you tell me about it?
Okay, it's it's a common disease in in young women that like some uh, the patient has a lot of how I said this. There's a hormonal um, I don't know, disorder. How is it?
Okay. Maybe disarrange, hormonal disarrange.
Yes, and that causes a lot of uh, maybe acne, hirsutism, metrorrhagia too.
Okay.
At in the patient, that's what she gonna say, like in the con.
Sorry, I didn't catch that last part.
That's what the patient and okay. At the physical examination, we noticed that we observed that the patient has overweight, and the most of the cases has greasy skin, that acne, like I said, and also can present in some signs of insulin resistance, because there's the this disease um, has this the patient with this disease has um, resistance insulin. Um, the complementary studies that we're gonna ask for is the first one, the most important, an ultrasonography. We can observe and the most of the cases like multiple cysts and in the ovaries, in the ovaries. Also, we ask for a pregnancy test. Also with that, the physical examination, the acne, the overweight, we also ask for maybe thyroid or hormones, the hirsutism, also can we ask for testosterone levels, glucose levels, the treatment for this disease is the the pills, the oh, I'm, I'm not sure.
Okay, one of the, for example, the treatment, the basic treatment is with contraceptive pills, actually, right?
Yes, yes, contraceptive.
Okay, so you did great. If you can answer what I'm about to ask, you get some extra points. Okay, you told me about hirsutism, right?
Yes,
Have you ever heard about the Ferriman and Galway scale?
excuse me. But
Ferriman and Galway scale. Ferriman Galway scale.
I think yeah,
Sorry?
I think yes, I've heard about, but I it's about hirsutism and women specifically, right?
Yes, it is actually a scale that classifies how serious is the hirsutism in patients with
And then
this disease.
and certain zones of the body. Yeah, I remember the images a little bit, but
Okay, okay,
yes,
you remember. Actually, I've never seen this getting used. However, it's interesting to read. Okay, Danita, since it's our last class now, let me tell you, you did great all over this course. You have, I think, one of the highest scores here. That is because you never stop trying. You have great pronunciation. However, you are a little shy. You get intimidated really easy. However,
yeah, that's
when you start speaking, I can notice that you have a great pronunciation. You have a awesome vocabulary. Your grammar is great. I think if I get to see one of your notebooks in English, I think I'm not going to find mistakes because you have a great grammar. Um, and that's why I'm always asking if anybody knows, and I always come to you because I know that study really hard, because you know some things that your classmates do not know. I think you read a lot, and that is great. That tells me you're going to be a great doctor. And let me tell you, you have to keep doing it, whatever you're doing, because you have a lot of information in your head. I think you don't know how to transmit that information because you're a little too, as I was saying, you're a little too shy. And keep doing it. You are going to be a great doctor. And it's been
Thank
a
you so much.
really great pleasure to meet you. I know that you're believing, so I know we have great doctors in process right now. So I'll see you at the end of the class, please, for the daily survey, okay?
Thank you so much, doctor. It was so nice to meet you too.
It's
I
okay.
enjoyed every class. They were amazing.
Okay,
You're
thank
a
you.
great doctor too. You're a great teacher as well.
Oh,
Thank you so
thank
much
you.
for everything.
Oh, thank you. That I really appreciate it. If you want to, as I was telling you with your classmates, if there's anything I can help you with, any topic that you might want me to tell you about or you do not understand, you can tell me. I really like teaching, and it's much easier for me. It would be much easier for me to do it in Spanish, right? And for you to understand also. So I'll see you at the end of the class, please, for the survey, okay?
Okay, doctor, thank you so much again.
Okay, thank you. Bye.
Bye.
Bernardo, are you here? Hello? Hello? Bernardo, are you here? Hello, Bernardo. Okay, guess you're not. Hello, Mariana.
Hello,
Hey, Mariana, how are you doing?
I'm fine, thank you.
Okay, so Mariana, we're going to have our last class actually. Yes. I'm sorry, I can't hear you. I think I'm having some problems with my microphone and my headphones. Do you hear me?
Yes, do you hear me?
Okay, now I do. Okay, so from now we have your 15 minutes. So um, basically what we're going to do is that you are going to choose any body system. I know that you are a physical therapist. So would you like to focus on musculoskeletal system?
Yeah, it's okay.
Okay. So could you tell me the structures that are involved in musculoskeletal system?
Yeah, well, the muscles are made of um, aces. It is said like that way.
Sorry, I didn't really catch that part.
Fascicles.
Sorry, I'm having some troubles. Okay, I'm getting rid of my headphones. Now you can you repeat it, please?
Fascicle.
Okay, yes.
Those are also made of smaller pieces that is called fiber.
Okay, fibers.
Yes. And inside of this smallest part, there are the sarcomers. I think
Okay,
it's called that
the
way.
contractile unit of the muscle,
Yes.
right?
Yes.
Okay. So we're actually almost at a molecular level, right?
Yeah.
Okay, what are those main molecules related to contraction inside a muscle?
Well, the contraction is made with the um, the release of calcium.
Okay, it is actually related to calcium, yes. So what about actin and
Myosin.
yes. Okay. So besides muscles, what other structures can we find in musculoskeletal system?
Tendon.
Tendons, okay. Anything else? You're going to work daily with those structures, right? Any other structure?
Ligament. I am not
Okay.
sure.
Yes.
Well, it's also related to bones because muscles wouldn't work without bones, but
Okay, bones and the were what is it called when two bones or meat?
a joint.
Okay, joints. How many types of joints do you know?
Um, well, I know all of them, but right now in English, I don't remember all names.
Okay, the ones that have higher that can move much more than the others.
Like, could you repeat the question, please?
Bernardo just joined and faded away. Okay. Yeah, well, you can tell me in Spanish what are those joints that are well that have much more movement than the others.
Oh, well, those are esferoidea y ellipsoidea.
Okay, and any other classification of those?
Yeah, you mean that can move a lot? Ah,
Yes.
well, there is la silla de montar, pivote, y hay una vez que estoy olvidando, but I don't remember which one is it.
Okay, so basically you know a lot more than I do. Okay, so and for example, in a person who has rheumatoid arthritis, what kind of joints are affected?
Which part of the joint?
What type of joints are affected? Because they're mainly, well, this disease actually
Well,
affects a certain class or type of joints.
mm, well, I'm not sure about it. I think that they are las esferoideas.
Okay, I think so. You know much more than I do. Okay, I what I read about is that in this case would be articulaciones sinoviales, right?
Yeah.
Okay, so could you tell me the parts of that type of joints?
Yes.
Okay,
Well, this type of joints are made of, well, two bones that are joined. This has a articular capsule. I think
okay,
so. Well, this structure is made of, well, the cartilage that is covering both bones. It has a liquid inside that is going to act like a lubricant, I think it's it. And I think that it would be a summary.
okay. You're making it easier for me to understand, right? Okay, what about the articular capsule? What is inside or in the inner face of this capsule?
A membrane
Yeah,
that is called synovial membrane.
sign of membrane, right? And what types of cells do you find in that membrane?
That's something that I cannot answer. I really don't know.
Okay, so we have type 2 and type 1 and type 2 cells, okay? Type 1 cells are the ones that are phagocytes, that are defense cells, immunity cells. And type 2 cells are basically the ones that produce that liquid that you told me, okay? They are also known as type A and type A and type B cells. So do you know what PANUS is? PANNUS, PANUS.
No, I don't know.
Okay. Um, what do you do in a patient with rheumatoid arthritis? How do you help that patient? Teach me, because I don't know actually.
Like symptoms?
Sorry?
Symptoms? You mean symptoms?
No, how you can help as a physical
Ah,
therapist.
okay. Um, well, in this kind of patients, we have to examine it in which phase of the disease it is, because it could be, in some cases, better to have a surgery to replace the joint than a treatment. But if it's not the case, well, the physician is going to do a treatment with medicines, and we are going to try resources like heat, passive movement. We are going to try to um, get his or her muscular strength to make it easier not to be weak in those kind of joints, depending on the joint, and making his or her daily life easier and more independent. That could be a summary.
Okay, great. Because in rheumatoid arthritis, what are the most involved joints in this disease? Do you know? You must have seen patients with this disease, right?
I haven't yet,
Okay.
but I think it's the hip.
Sorry?
I think it's the most affected joint is the hip.
Not actually. It is metacarpophalangeal joints.
Mm,
Okay, the knuckles, right? You know knuckles, right? Knuckles and proximal interphalangeal joints. Those are the ones. Okay, so
mm,
around those joints, muscles get really weakened, right? So I think those, I'm going to say it in Spanish for us to get to understand better. Los músculos que están, bueno, periarticulares, ¿no es cierto? De esas articulaciones, por ejemplo, los interóseos están, hay una atrofia de los interóseos. Supongo que ahí ustedes podrían ayudar, ¿no?
yes.
Okay. Well, we are done with your 15 minutes. Let me tell you, you have an awesome pronunciation. When you start speaking, it's like talking to a native speaker. I also realized that we have great professionals in healthcare services, just like you. Um, what I really liked about you is that you, as well, you never gave up. And we've been talking about well more medical stuff because I'm a doctor, you know, and you never gave up. I had at the beginning of this course, we have 15 students, and they were all medical students, and most of them gave up. Right? You're only 5 left now. Today, for example, you're only 5. Um, that tells me a lot about you. I think you never give up. You know a lot. You actually are able to teach me. You are able to teach any of those students who are now your classmates. Keep that. Keep doing it. You're going to be an awesome professional. And when I need a physical therapist, I'm going to call you. Okay.
Thank you. Well, for me, as you, um, it's a great pleasure to meet you. I think you have a lot of knowledge, and you have taught me a lot of medical stuff that, like you said, for me is really interesting. I really love my profession and all medical or health stuff in general. That's why I chose physical therapy. But I'm going to learn more about a lot of topics that I heard in these classes, and I'm really thankful about it.
Okay. Thank you. Thank you for saying it. Okay, so I'll see you at the end of the class, please, for the daily survey, okay? It's been a huge pleasure for me.
For me too. Okay, see you later.
Okay, see ya. Hello, Marcela.
Hi,
Hey, how are you doing?
I'm fine. What about you?
I'm getting better. Yes, I'm almost healthy now. Okay.
Good news.
Yeah, thank you. So, today we're we're having actually our last class, and this is what we're going to do, okay? You are going to choose any body system that you want right now. We have the cardiovascular system, respiratory system, gastrointestinal system, nervous system, musculoskeletal system, intertegumentary system. Well, there's a lot of them, so you can choose one.
Okay, I would like to choose a pulmonary.
Okay, respiratory system. right?
Yes.
Okay, respiratory system. Could you tell me the parts, well, the structures related to respiratory system? All the
Well,
structures that you might remember.
well, there is the lungs, obviously. There is also the I don't know if I'm good with the pronunciation. Bronchiolos,
Bronchioli, you remember?
bronch bronchioli. Sorry. There is also the. I'm gonna mess up a little bit with the pronunciation with all the speakers maybe, but there is also a bronchus, trachea, um,
Trachea. Okay.
there is larynx,
Larynx. Okay.
and the nasal cavity, which also contain the nasal, sorry, conclave, uh, and the I'm gonna can I say this in Spanish?
Okay. Just one word, and then you're going to say it in English.
Senos sinusales.
Okay. The sinus, respiratory sinus.
Yes, I know. Okay, and there is also this muscle, the diaphragm that is involved in the respiratory system. And these little things that are in the lungs, the alveoli,
Alveoli. Okay.
alveoli, sorry.
Okay, great. You did great. You told me a lot of structures related to it. So, could you tell me anything about physiology in related to the respiratory system? Anything you want. By the way, let me give you a piece of an advice related to pronunciation. Okay, it's actually nasal, not nasal. Nasal
Nasal.
cavity, for example. Okay, great. Nasal cavity. Okay, would you like to tell me anything about
Well,
physiology related to the respiratory system?
okay, there we know there is an exchange of oxygen and and CO. I forgot how to say dioxide of carbon. Sorry,
Okay,
uh,
it is actually carbon dioxide.
carbon dioxide. So there is an exchange between these both cells, well, molecules. So it
Molecules.
molecules. So this exchange it will happen between the alveoli and in between. Well, I know that there is like it must has to be a pressure to make this exchange happens. That it's if I'm not wrong, 117 at ATM.
Yeah. Which is
So
ATM?
atmospheres,
Right. Okay. Atmosphere in English, right?
atmospheres. Okay. So what happens is that the carbon dioxide comes from the vessels in the blood and goes it makes some exchange in the alveoli with the oxygen and to give these new molecules to the to the arterioles and to go over the body to well that helps this oxygen will go over the body to well no it goes to the heart and then it's after that it goes over the body to make us keep alive because we cannot live without the oxygen. And I don't know what else can I say. Well, that's in some uh, Yeah, and I know there is also a term that I like it about this when I was studying the respiratory system. There it's in Spanish, espacio anatómico muerto. I don't know if you remember that.
Yes, the death anatomical. Yes, and what is it about? I mean, how is it different from the death physiological?
In every breath that we take, there is a part of the air there. It's in our body that it doesn't make any exchange of molecules. That's the as a as in the as an easy way to say it. And in this air, it's contained in trachea, larynx, and the nasal cavity.
Great. So it is actually where there is no any gases exchange, right?
Yes.
So we have air inside our um, airways. However, there is no gas exchange. Great. So, is there any disease you might want to tell me about related to the respiratory system?
I like it a lot. Asthma.
Okay, great. What could you tell me about that disease?
So asthma is when the in the bronchiolus there is well like loose. It's the same as light in English to refer to this space inside the bronchiolus.
It could be.
Okay, so inside this bronchioles in the light of this one, there is a mucus that interferes in the well in the moving of the air for saying in a way. So a person that has this disease or this condition, it will have some difficulty, some issues with when they are breathing in some point, at some point, sorry.
Okay, so mucus, right? The first one of the first pathological findings, actually. Yes. Is there any other findings in the pathology in a patient who has this disease?
I don't understand. What do you mean?
Okay. So, for example, we have this patient with asthma, right? And you ask for a pathological study of sputum, right? Sputum is esputo, right, in Spanish. So, and the pathologist, which is actually a specialty, right, sees under the microscope this sputum and finds, well, can see some findings. One of those is mucus that you told me about. Is there any other? Is there any other finding related to asthma?
I really don't remember. Sorry.
Sorry.
Well, while I was reading about that, I don't remember if there is anything else that it will be found out.
Okay. So another finding would be some dead epithelial cells. Okay, those are called Creola's corpuscles. In Spanish would be corpúsculos de Creola. Okay, there's another pathological finding. Okay, what about clinical features? We have a triad actually related to asthma. Do you remember what it was? This triad?
What is triad?
Triada.
Oh, Well, I think it will be a how can I say the well, there is obviously I don't know, I forgot this word. Short of breath,
Shortness of breath.
shortness of breath, and also there is like a little bit sound when this person is breathing out. I don't know if that one counts as part of.
Okay. Well, the triad is actually based on the clinical features. For example, one of the components of the triad is cough.
Mm,
What about the other ones?
the other one it's dyspnea,
Dyspnea.
dyspnea, and I don't know how to say this one. Sibilancia.
Great. Whistling.
There is, sorry, how do you say?
Whistling. In
Whistling.
well, that is actually like a verb. To whistle in Spanish would be silbar. Okay, to whistle is silbar. Okay, so when you use your stethoscope to listen to your patient's lungs, you can see you can hear whistlings. Okay, so
Mhm.
the triad would be cough, dyspnea, and whistling. Okay, so what is the main treatment for asthma?
It, the first one it will be I don't know if I'm wrong. How can let me think. Steroids, actually not, or right.
Corticosteroids, right?
Hmm.
Yes, this is actually the um, the basics of the treatment. And a lot of years ago, uh, the treatment was with, for example, salbutamol, right? However, it is not the basic treatment right now because it made a lot of people to die from a heart infarction, actually. So it increased the mortality, and now the basic treatment is with what you just said, with corticosteroids. Okay. Anything else besides
Well,
corticosteroids?
there is a combination in others.
Okay.
Um, I think those ones are the most like famous ones.
Okay, those are the most important ones, actually, right? Okay. So, Marcela, it's been a really huge pleasure to meet you. We're done with your 15 minutes. I like how enthusiastic you are about medicine. Uh, this tells me a lot about you, that you really, really like our profession, because I consider you're already a professional because you put a lot of hard work into whatever you read. And when I ask for any homework for you, you're the first one to tell me that what I asked for. That shows how work you hard, and that tells me that you're going to be a huge doctor. And it relieves me because in Latin America we need more professionals like you guys, especially like you, because you're a hard work student. Uh, Let me tell you, you keep doing it, and you're going to get really, really far. It's been a really huge pleasure to meet you. And I hope to see you again. What else can I say? Take care. I'll see you at the end of the class for our survey. Okay.
Thank you so much for your words. What words? It goes to my heart.
Okay, thank you. Okay,
See you at the end.
okay,
Bye.
bye. Bernardo, I've been calling you 2 times and you didn't join the meeting.
Sorry, Doc, I have several problems with the internet.
Okay, don't worry about it. Okay, from now on, we have your 15 minutes, okay?
Okay.
Okay, so what basically we're going to do is this. You're going to choose a body system, okay? Any system that you want to, gastrointestinal system, cardiovascular system, respiratory system, nervous system, intertegumentary system. I mean, there's a lot, right? So you can choose one right now, please.
Respiratory.
Okay, respiratory system. What could you tell? Well, could you name all those structures that you remember of related to respiratory system?
Yeah. Yeah, pharynx. Pharynx.
Pharynx, okay.
Pharynx. Trachea. ¿Cómo se decía? Trachea.
Trachea.
Trachea. Bronchus.
Okay.
And lungs.
Larynx, okay. Trachea. How do you call the part in which the trachea divides into two main bronchi?
It's
just like in Spanish.
¿cómo se llamaba? I don't remember who the name.
Karina, right?
Karina.
Okay, you're missing the most important structures.
Alveolus.
Okay, the alveoli. Okay, and what about the lungs?
But I say lungs.
Really? Sorry, I didn't catch it. Okay, the lungs. So could you tell me anything about respiratory physiology?
It's the change of the oxygen and the dióxido de carbono.
How do you call that gas in English?
Carbon.
Yes, you're doing great. Carbon.
Yeah, I don't know who is next.
Okay, it's carbon dioxide, right?
Dioxide.
Okay, so it's like a gas exchange, right? How do you call that process of gas exchange?
I don't know.
Maybe you can remember in Spanish?
Intercambio gaseoso.
Yes, but it has a specific name actually in Spanish, in English too.
Hematosis.
Yes, great. So, how do you call that in English? It's really similar to Spanish, this word at least.
Hematosis.
Hematosis. Hematosis. Okay, great. So this is like a process related to pressures and
Mhm.
the exchange of gases. So, anything else you would like to talk about related to physiology in respiratory system?
Mm, I don't know. Maybe that the hematosis, or I don't know.
Okay, so let's get to the pathology part. Okay,
Okay.
so any disease you might like to talk about in respiratory
Mm,
system?
atelectasia,
Oh,
or
great. Yeah, and in English would be atelectasics. Okay,
yes. Okay.
what is it? How would you explain that disease?
It's when the pressures um, prime one lung, and that makes the lung goes more small. Who I think is that.
Okay, you're close to it. What kind of diseases could be related to this?
Mm, maybe an accident and ¿cómo se llama? Mm, um, pleuritis.
Okay, great. So, mhm, what about the treatment in this kind of? It is actually more like a finding, right? Because it could be related to, uh, well, a great number of diseases. Actually, it's more like a finding. So,
Mm,
in any kind of disease, how would you treat atelectasics?
uh, maybe if it's pneumonia, try the bacteria or something that make that. And if the lung is very damaged, it's direct to surgery.
Okay, yeah, so it depends, right, on the cause of the atelectasics. As you were saying, in pneumonia, actually, it is related to the treatment of the infection. And how else could you help your patient? We already talked about therapeutics, right? Besides besides antibiotics, how else could you help your patient?
Mm, uh, I think first starts with a simple antibiotic like the I don't remember the name, but it's the most uses. Um, um,
You can say it in Spanish if you don't remember the name in English.
Amoxicillina.
Okay, it could be, right? And any other antibiotic that might be useful for pneumonia?
Mm,
Amoxicillin besides amoxicillin, yeah. Because actually, this is the first line antibiotic, right? Is there any other that might be useful for it?
maybe azithromycina.
Great, awesome. Um, what family does it correspond to? Do you know?
No.
Okay, in Spanish, maybe?
Macrólidos, tal vez.
Yes, great. Correct. Okay, anything else you would like to add about any kind of disease related to the respiratory system?
Mm, tuberculosis.
Okay, what can you tell me about it?
It's infection for a bacteria, and that it's very present in our country, and affect the lungs and another organs like the liver and the kidneys. And I don't know what more say.
Okay, so I'm going to start asking you. In Spanish, can you tell me la tríada de Colombino? That is actually related to tuberculosis, and you asked for it. So,
Yeah.
Do you remember?
Maybe how I say orina in English?
Urine.
Urine, acid urine, and I don't remember more that.
Okay, maybe in Spanish?
No, tampoco.
Okay, it is actually aciduria, right?
Yeah.
Piuria y abacteriuria, right? That is for what part? Well, tuberculosis related to which organ?
The kidneys.
Yes, it could be, right? Actually, once I saw this, you might think that you're not going to see this and it might not be considered useful, but I did see this triad actually in my hospital. It was quite interesting. So, Bernardo, I think we are done with your 15 minutes. Well, since this is our last class, let me tell you, it's been a really huge pleasure to meet you all, guys. You, of course. I like the fact that you didn't give up. I mean, at the beginning of the class, you were almost 15, I guess, and you kept trying and trying, and that tells me a lot about you. So keep working hard. Mm, as for English, you have to practice on your pronunciation, okay? And I know that you know a lot about medicine because you answered a lot of questions that I asked. You also made some homeworks that I left for you guys. It's been a really huge pleasure, and well, anything you might need, you can tell me, okay? You have my phone number, and you all have my phone number, and I'll be there for you guys. I'll see you for the survey, okay?
Okay, really, thanks, docs. And sorry for my English. I forget all of the school I learned, but I appreciate your class and thanks.
Okay, you're welcome. I know that you know English. However, you have to practice on your pronunciation. That would be it. Because I think if I saw any of your notebooks in English, you have good grammar. However, your pronunciation is like your weak point, but it's made of practice, right? So you have to keep practicing on it. Okay.
Gracias, Doc.
Okay. See ya.
See ya.
Okay, guys. So we reached the end of our classes. As I told each one of you, it's been a really huge pleasure for me to meet you all. I know you're going to be great professionals. Anything you want to, um, you have my phone number. If you want me to, if you would like me to explain something in Spanish, it would be much easier for me and also for you to get to understand. I'm all ears. I'll be there for you guys. Thank you for staying at the end of this class. I mean, at the end of the class, at the beginning of the class, this classes, you were 15. You are a few people right now, and I really appreciate it, guys. That shows me how committed you are to this. Okay, anything you want to, anything you need, you can write, you can text me. I'll be there for you guys. Okay, so let's go for our last polls. We actually have 2 surveys today. Okay, so let's get started. Okay, thank you guys. This will be the last one, okay? The last survey. Our coordinator, Allison, asked me to do it also, okay? Hello, guys.
I'm done.
I'm done too.
Okay, there are 2 people left. 1 left. Okay, so thank you guys. I hope to see you again some other day. Take care. It's been a really great pleasure to meet you all. See you guys.
Bye. Thank you.
Thank you.
Thank you.